Hello, dear friends and colleagues. Today, I'd like to talk about another rare disease, but very common in exam. Again, examiner like it most, and candidate don't like. I'd like to clarify this topic, and I'd like to emphasize uh, the some point where examiner will test your knowledge. It is amyloidosis, not formal definition necessary for amyloidosis. Just I'd like to um, clarify and simplify and to understand what is amyloid and what is amyloidosis. Just remember it, amyloid is an abnormal protein in our body. Every day, in every second, different kind of protein is producing and secreting and utilizing by the body, enzymes, hormone, structural protein. So this is necessary for the body, but unfortunately some protein in the body which is structurally abnormal, unfolded, it is not degradable, and it is also not functioning. This protein, non-degradable protein, abnormal structures protein, is actually amyloid protein. In several conditions it can produce, and when it deposited in the body cannot remove this protein, so it is accumulating day by day and give rise signs symptoms is related to the organ involved. Okay, so amyloidosis is non-degradable, structurally abnormal protein that is produced in our body and deposited in the extracellular space of different organ and cause the sign symptoms of deposited organ related symptoms. So when this sign symptoms is related to the depositions of amyloid protein, it is amyloidosis. Two types: localized, when it is just uh, deposit in the local organ, one organ is localized, and systemic, when it is deposited in the many organs of the body. So systemic again divided into two: one is primary, another is secondary. Primary, that means AL, amyloid light chain. This is actually primary. This secondary to some protein production, light chain production. It is actually, we say that primary amyloidosis, and secondary amyloidosis usually due to chronic inflammatory disease, AA. So AA, that is acute phase protein amyloidosis, and AL, amyloidosis related to the light chains of globulin. So globulin produced from plasma cell, hypergammaglobulinemia. Where happened it? Multiple myeloma. So in multiple myeloma, from the bone marrow, plasma cell produce millions of gamma globulin, and in gamma globulin there is heavy chain and light chain. Light chain either kappa or lambda. So excess amount of kappa or lambda chain, that is light chain, is produced from the multiple myeloma. Other cause also lymphoma. Other cause is also related Waldenstrom macroglobulinemia. So these three conditions produce light chain. These are the cause of primary amyloidosis. These light chains deposited in the different part of the body and cause different symptoms. I will discuss later on. Secondary, related to the chronic inflammatory or infectious disease. Most common with rheumatoid arthritis. Rheumatoid arthritis produce acute fresh protein. This acute fresh protein continuously producing from the liver and deposited in the different organ and gives rise to the symptoms of organ involved. This is secondary amyloidosis, other inflammatory bowel disease. So in rheumatoid arthritis, the organ involved usually in the kidney. Now I'd like to discuss about organ involvement and symptoms of amyloidosis. In primary amyloidosis, that a light chain kappa or lambda deposited in the different part of the body and give rise to symptoms. So I'm just talking about another amyloidosis localized is deposited in the local tissue, local organ. So I'm just starting about the depositions of the amyloid body of the different part and what symptoms we'll get. Start from the top, brain. If brain amyloid body deposited in the brain function will be abnormal. So memory of the brain will not work properly to give rise dementia, and most common cause of dementia is Alzheimer's disease, and Alzheimer's disease is thought to be due to deposition of amyloid body. So it is one kind of amyloidosis. Come to the tongue. Amyloidosis, amyloid protein can deposited in the in the tongue tissue, extracellular obviously, and tongue become bigger. So it is cause of macroglacia. Other cause of macroglacia also I'd like to include here, just for remembering. Amyloidosis is one of the cause. Second cause hypothyroidism. Third acromegaly. Fourth Down syndrome. So these are the cause of macroglacia. So amyloidosis is one of the cause of macroglacia. So what symptoms will give rise? Patient, because tongue is bigger, speech will be slurred. When you will see the big tongue. Okay, then come to the heart. It will deposit it in the extracellular space of the heart, and heart muscles expansibility will be reduced. So there will be restrictive type cardiomyopathy. Okay. Then come to the liver. It can deposit in the liver extracellular place beside hepatocyte, and it will press hepatic cell and the accumulated amyloid. When it will be more, then there will be hepatomegaly and hepatic function will be lost. So there will be chronic liver disease with hepatomegaly. It can deposit it in the spleen and it can cause similarly splenomegaly. It can deposit in the pancreas, islet cell pancreas. So patient beta cell function will be lost, acinar cell, so exocrine function will be lost. So there will be indigestion, and diabetes. It can be deposited in the kidney. Where it will be deposited? It will be deposited in the podocyte and the glomerulus. So in podocyte, it will prevent the loss of protein. But when it deposits in the podocyte will be lost, and protein will be losing through urine, and it is proteinuria, massive proteinuria will be occur, and there will be nephrotic syndrome, and as well as kidney failure. Now it can deposit it in the joint. When it will deposit in joint function will be also uh, lost. So there will be joint pain. It can deposit in the nerve. So in the nerve, it can deposit beside axon and beside that is dendritic cell, schwannoma, swan cell, not schwannoma, swan cell, sorry. And if it deposited, the function of the swan cell also will be arranged. That is, conduction defect will be there, and nerve because of the axon there will be conduction defect and nerve function defect, so there will be peripheral neuropathy. Well, if it deposited in the autonomic nerve, it will cause autonomic neuropathy. If it will deposit it in the joint, for example in the wrist joint, it can give rise carpal tunnel syndrome. So, according to the urban involvement, it will give different type of symptoms. Just remember that reactive, that is inflammatory, a amyloidosis related to the acute inflammation usually involve kidney first, other organ can be involved. Primary amyloidosis due to multiple myeloma, lymphoma, Waldenstrom macroglobulinemia, it can involve any part of the body. Okay. Now, uh, localized amyloidosis, it can involve in the bladder, deposited in the bladder only, deposited in the eye, deposited in the uh, any skin. It can deposit it, and it is localized only. It is not so uh, harmful. Sometimes surgical removal, it can, you can get cured. So if I summarize up to this, amyloid is abnormal protein, it non-degradable protein deposited in the extracellular space, and accumulation give rise to different types of sign and symptoms according to the organ involved, and which organ involved already I discussed. Now, how will diagnose? Yes, this is one question in the exam you will get. Diagnosed by biopsy. Where is the location of biopsy? From where you can take biopsy? Fat, periumbilical fat, subcutaneous fat you can take, fat cell, and by Congo rate and polarized camera, you'll see the apple green bifringent. This is the question of exam. Congo red one, Western, sometimes you may say the Indian in Congo red, James sustain, something like that, but your answer will be Congo red. What type of findings you will get? It is apple green bifringent. Okay, and from where you will take biopsy? Subcutaneous fat, periumbilical subcutaneous fat, this is a good place, rectal mucosa and buccal mucosa. Though positive rate in buccal mucosa less, rectal mucosa more than buccal mucosa, and fat is more. Other part biopsy can be taken from other part. like liver, kidney, but because it is invasive, not necessary. We can, so in exam they will give some option: subcutaneous fat, rectal mucosa, buccal mucosa. Okay, this is the diagnostic test. Treatment, there is no cure, unfortunately. What we can do, for example, in primary amyloidosis due to multiple myeloma, we can treat multiple myeloma by chemotherapy. So it will reduce the productions of the amyloid light chain, and disease will not progress, and treatment of the symptoms. In rheumatoid arthritis, treatment of the rheumatoid arthritis or inflammatory disease, inflammatory bowel disease, will stop the productions of the amyloid acute protein, and disease will not progress. So it will be helpful. Nephrotic syndrome, treatment of the symptomatic nephrotic syndromes. And if kidney failure, then renal transplantation, organ transplantation, this type of treatment will, but there is no cure. Only we what we'll do is stop the disease process if there is, and treat that cause. Probably it will not progress rapidly, and patient will get benefit from that, but there will be no cure, unfortunately. Some other topics I'd like to discuss in exam point of view. There will be scenario in case of chronic renal failure, there one type of amyloidosis will be occur. What is that? Beta 2 microglobulin. So a chronic dialysis patient will have amyloidosis of beta 2 microglobulin. Just remember it. Some familial amyloidosis also there, that is transthyretin uh, amyloidosis. In family, some family there is mutations, transthyretin protein, and the abnormal amyloidosis can be there, though it is not necessary in exam. Other non-familial rare amyloidosis also there. There are a lot of amyloidosis, but if just what I discuss, remember it and try to solve this diagnostic procedure. Biopsy, what is the stain, what will be the finding, in dialysis what type of amyloidosis related, beta 2 microglobulin. In primary amyloidosis, what type of amyloid is related, this is light chain, kappa or lambda. And rheumatoid arthritis, that is secondary amyloidosis, acute phase protein AA, amyloid protein related. And patient may give rise different type of symptoms. So remember this, and presentations of the patient in different way. Maybe in scenario they will give that a patient came with frothy urine. You have to think about nephrotic syndrome. So frothy urine, hepatosplenomegaly, carpal tunnel syndrome, peripheral evidence of peripheral neuropathy. You have to think amyloidosis, and patient is having multiple myeloma, back pain. So disease, primary disease symptoms also, back pain always. You have to think about amyloidosis. Uh, Patient may develop constrictive cardiomyopathy, so you will get features of cardiomyopathy, that is difficulty in breathing, dyspnea, exertional dyspnea you can get, pulmonary edema you can get, features of right heart failure you can get. So you'll get this type of symptoms of disease, related disease, and its complication, amyloidosis. So those symptoms just correlate each other, and Just think about whether it is primary or secondary. If inflammatory or infection related, secondary. If multiple myeloma lymphoma and Waldenstone macroglobulinemia, think about primary. Alzheimer's, beta amyloid deposition. So just remember this. I think you can answer any question related to amyloidosis, and examiner probably will not go far from this what I discussed. So thank you very much. For next video, just stay with me and subscribe my channel. I'll be coming very soon with another hot topic. Thank you very much.